This is Coach PDHPE. We're up to Core 1, Key Idea 1.1. The name of the core is Health Priorities in Australia, and we're starting off with the first key idea: how are priority issues for Australia's health identified? Here is the first part of the syllabus. We've got on the left-hand side the student learn-abouts, that is measuring health status, and the two dash points underneath it. The right-hand side of the syllabus, which is the student learns to, is critique the use of epidemiology to describe health status by considering questions, and there are three of them. I'll come to those in a moment. But we're going to start off by just looking at why even bother measuring health status. Well, for government and other key organisations within the health industry or health sector, it's really important that they study health statistics so that they can make informed health decisions. Now, the federal health budget, for example, is in the tens of billions of dollars, and when you spend that sort of money, you'd want to be spending it wisely. So they gather health statistics to try and help them make sensible decisions with the health budget. Analysing health statistics can also enable governments to target health issues that have become a problem in the community. So in recent years, there's been a huge increase in the number of people suffering from diabetes in this country. So the government has made that a health priority area and directing extra funds towards it. Now, the role of epidemiology is the following, can undertake some of the following points. It can help find out how many people have a certain type of disease. So, for example, how many people have cardiovascular disease in this country. It can tell how many people have died of a particular type of disease, e.g. lung cancer. It can also say or inform people of how much money does it cost to treat mental illness, as an example. And it also can help determine what are the factors that cause HSC people to have higher rates of diabetes. So that is the role of epidemiology. So this study of health information is known as epidemiology. Now, a second dash point is measures of epidemiology, and there are four key factors: mortality, infant mortality, morbidity, and life expectancy. And I'll have a quick look at each one of those right now. The first one, mortality, is known as the death rate. Pretty depressing, but it measures how many people have died from a specific illness or disease over a period of time. Now, one of the things the syllabus wants you to do is know the trends. It doesn't need you to know exact statistical information, but it wants you to know some trends for the leading causes of death in this country. Now, one of the main ones here is cardiovascular disease, and the good news for cardiovascular disease is the trend is down for mortality rates. That means fewer people are dying from cardiovascular disease every year. Now, I don't have time to go through all the other leading causes of death. You'll have to do that in your own time. Now, the next key factor in terms of measuring health status is infant mortality. This measures the number of deaths under the age of 1 per 1,000 live births. Now, this is considered a key health measuring statistic in terms of how healthy a nation is. And the good news for Australia is that the trend is definitely going down for that in terms of Australia, although there are some worrying signs for HSC community where they have a way above average in terms of infant mortality compared to the rest of the population. Now, morbidity is a measure of disease rates, e.g. how many people, good spelling there, how many people have cardiovascular disease in this country, as an example. Now, that can get defined into two specific areas, and there's two further definitions here. One is incidence. This is the number of newly diagnosed cases of disease. So, for example, how many people were diagnosed with breast cancer in this country in 2013? Now, the other one is prevalence. So that's more the total number of cases of disease existing in Australia. So, again, using breast cancer as an example, how many women in total have breast cancer in Australia? So you can see the difference there. Incidence is to do with how many in the last year, while prevalence is the total number of people. And finally, the last key indicator is life expectancy, and this is the average number of years a person can expect to live for. Now, in this country, again, the news is good. The trend is going upwards. That means people are living longer, although it doesn't necessarily indicate anything about the quality of life those people are experiencing. So we now go to the right-hand side of the syllabus, the student learn to, and there are three questions we're going to look at. The first question is, what can epidemiology tell us? And I've got 3 points there. It identifies all causes of death and shows any emerging health concerns. So, for example, as I mentioned before, it will raise the issue of diabetes being a major concern in this country. It also determines the illnesses and diseases that need to be targeted with extra funding. So again, diabetes, that's been an emerging health concern. The government should be allocating more funds towards that. And finally, it helps evaluate health promotion initiatives. So a few years ago, there was a health promotion initiative called the Measure Up campaign, which was used to try and lower the rates of obesity in this country by getting people more physically active. And by studying information such as cardiovascular disease, diabetes, etc., health officials will be able to determine whether that health initiative was actually successful or not. The second question is, who uses these measures? Who uses epidemiology information? Well, one key area is government health policy makers. They're those individuals responsible for allocating dollars from the health budget. Secondly, makers of all health products, e.g. companies that make diagnostic machines. Now, an example of a diagnostic machine is an MRI machine. It's really helpful for them to know what are the leading causes of disease and death in this country, as they can then make the machines that help in terms of prevention for those diseases. And finally, individuals. If individuals are aware of different diseases that are causing problems in the community, they are then able to take preventative measures to help not get that disease. And finally, the last question, does epidemiology measure everything about health status? Well, there's 3 points there which says no. The first of those is, although epidemiology provides large amounts of statistical information, that information still needs to be interpreted correctly. So that's quite tricky in a number of instances. Secondly, it cannot give information on how each determinant of health, the 3 R's, socioeconomic, environmental and sociocultural, influence the statistics. So it's not able to say, for example, what role socioeconomic determinant plays in the number of people with cardiovascular disease. And finally, on life expectancy figures, although the figure is going up, which is good news in terms of the health status of this nation, it does not provide information on whether the quality of life of individuals is improving. So that's dot point 1 of Key Idea 1, Core 1 covered. If you need more information for any Year 12 PDHPE information, you can visit the website coachpdhpe.com or at Twitter, coachpdhpe.